Hey everyone, welcome to the Slice of Healthcare podcast. I'm your host, Jared Taylor. Joining me today is the Chief Clinical Officer of Phreesia, Hilary Hatch. Hilary, how are you today?
I'm great. You got me on a rainy Friday. Thanks for having me on the show.
Excited to chat with you here today. Yeah, it's not raining here. This is not. I'm down in Florida, and this is not yet our rainy part of the year, but we are getting there quickly. I noticed when I went outside the other day, and it was 88% humidity. It has hit us. You'd laugh, but I bought a portable what is it called? The portable AC that I wear around my neck when I go outside. It's
And one of
unbelievable.
those little fans you could attach it to your hat.
It is a game
Slice of
changer.
healthcare fan.
Oh, there you go. Yeah, there you go. But everyone, it looks like a dog collar. So everyone's kind of looking at me strangely when I walk down the road, but I'm cool and, nice, cool, calm, and, maybe they're not. So anyway, really excited to have you here today. Let's kick things off by you telling us a little bit about yourself, and then we'll go into Phreesia.
Great. So I am a clinical psychologist by training, and I serve as Phreesia's Chief Clinical Officer. As a psychologist, I've really been trained my whole career to understand patients' knowledge, skills, and ability that they're bringing into the situation when you work with them, and to really try and meet them where they are and welcome them into the role of being a patient, and really train them in the role of a patient with no expectation that people really arrive ready to do the hard work of being a patient. That's one of the things you really learn as a psychologist. But it really applies much more broadly than psychology, because successful health outcomes across the board really depend on a patient's ability to self-manage their health and on the patient's ability to take an active role in their care and be a partner in their care.
And what would you say to someone that just walks up to you and at like random person on the street that's never heard of Phreesia before? What would be kind of the core pieces that you would want to quickly resonate with them when you tell them?
Yeah. So, the funny thing is, more and more these days, when I ask people ask about Phreesia, they'll say pretty quickly, "Oh, I've actually used that in a visit, and I didn't even realize it was Phreesia." So we enable more than 150 patient visits a year. We're most known for a digital check-in solution. And so people will be checking in for a doctor's visit, and they will fill out their demographics information. They'll a lot of times pay their copay, get screened for depression, hear about the vaccines they're due for, and then they'll arrive at their visit ready to go. And that's what we're most known for. Our mission is to make it easier for patients to arrive, and that every person arrives sort of ready to be an active participant in their care. We really believe that an activated patient isn't a nice to have. It's really essential to the core clinical, business, and operational success of all healthcare organizations. So we give organizations tools to help people take that active role in their care. And success is when people are showing up to their appointments on time, prepared, all their paperwork's done, they're educated, they're aware of how to be up to date on their preventive care, they're taking their prescriptions, and they're ready to take the best advantage of that in-person time.
You talk about helping or taking an active role in patient care, right? How has that active role maybe changed in recent years, or has it been pretty much the same over the last couple of years?
So I would say, by and large, patients taking an active role in their care has not changed, but certain things have changed. COVID had a huge impact on people getting behind in preventive care. We all know that. There's been lots put out about that. So if you're sort of starting from behind on anything, it's harder to catch up. It just means that people were much more likely to get behind on their vaccine schedule, their preventive cancer schedule, maybe misdiagnoses of some chronic diseases. And when you're starting from behind, it's going to make patients that are already struggling to sort of navigate the healthcare system and get the support they need to be good at managing their health, they're like a step backwards. And so I think it has been a challenge really in the last couple of years to get people back up to speed.
And do you foresee any like what's the next wave of challenges when it comes to that patient care that you think we'll end up seeing, or maybe we're already in the midst of?
Yeah, I mean, one thing I would say is that I don't know if you've ever heard the statistics, but that if a doctor were to keep all their patients updated on all their preventive care, they would spend 27 hours a day doing that for their full patient panel. It's just totally impossible. And the CDC is doing this great work right now, trying to bring to, use the trusted doctor as the mechanism to help with public health, whether it's vaccination, preventive screenings, medication adherence, all these areas I want to talk to you about. But we can't just keep jamming that into the doctor's workflow, because the patient comes in for other reasons. They have other things they have to do. They got to manage really serious chronic conditions or an emergent condition. And so really what I think that sort of the next phase is, how do we use 21st century technology that we're using everywhere else in our lives to address these situations? Personalized messaging, getting people right at the point that they could take an action so that they walk into a visit or get the message when they're not there, to get scheduled for things and get back on track with their care. And I think that kind of using that personalized messaging, getting to people right at the point when they can take an action, using the best that we have in terms of behavioral science, all of that really feeds into this vision of using the time with the trusted doctor really well.
One of the things I notice when you talk with a lot of physicians out there is their background does not really position them for things like nutrition and exercise, right? How important do you think, when it comes to the clinicians out there, that next phase of like continuing to, I'm not sure, right, if we're doing this more in the medical and nursing school and other avenues right now, but how much of a priority is things like nutrition and fitness going to be in the years to come when you talk about preventative care, right? Just what are your thoughts on that? Because I've been having more conversations with guests about that recently, and it seems like the tide is starting to turn a little bit to this needs to be a bigger priority, of course.
So I think you have, again, you go back to that 27 hours. It's not that clinicians don't think this is important. It's that it's just there's no way to achieve all that in the time that they have with patients. So you have a real movement in accountable care to have a broader care team addressing patients. But then it's really important to know which patients need what, like how to get them up to date and get them the right message. And then to know the patients that are going to need that added support, that sort of personal touch, that just one ping isn't going to be enough for those patients. And so I'll talk about two things that we're doing about that. One is this strategy of just really simple, consistent, personalized messaging to people when they can take action. We found that to be incredibly impactful. So, for example, flu season, 1 in 5 patients will catch checking in that needs flu vaccine, hasn't gotten it, and they'll get it on the spot during that visit. We're driving HPV vaccines, RSV vaccines, COVID vaccines in those kinds of campaigns. And likewise with preventive cancer care. For example, we did a breast cancer awareness campaign recently. And in 10 days, we've reached more than 250,000 people. And people found this campaign incredibly helpful. And one thing that was interesting was that Black women found the breast cancer campaign even more helpful than white women did. It just is maybe not having as much exposure to this constant message. And so we think it's incredibly important to get really personalized messaging out to people in this consistent way. With lung cancer screening, for example, a screening that's really underutilized. We saw a 234% increase of high-risk patients getting a lung cancer screening after getting very personalized, tailored messaging if they were at risk. And so that's the kind of stuff I'm super excited about, that I think can really help with the burden problem. And the part that when you talk about sort of nutrition and exercise and all that, So you've got bigger care teams potentially, but you still have a problem of sort of figuring out, well, which patients of mine just need a little nudge and they're going to go out and figure it out on their own, and which patients of mine really need some handholding and support, and they're really like going to be easily defeated and not take the medicine or the instruction or go follow up on their own, but they really need more support. And so another thing that we work on is called the patient activation measure. And that's really a way, it's a brief survey that helps care teams understand among their patients who needs that extra support. And that makes what you're talking about a lot more feasible, because if you know who can just kind of get the instructions and run with it, and who's going to need that extra time in an accountable care situation, it just makes a huge difference. And we're really excited about that work. We're working on some innovation models with CMS on using the patient activation measure, and excited to see those results published when they come out soon.
How I guess difficult has it been to get responses on, surveys can be hit or miss, right? Like how has it been collecting that information?
Yeah. Well, Frisia's in a very spoiled position in this regard. When people are checking in for their visits, they'll mostly just they'll do the what's in front of them. And as long as we're really conscientious about not making it too long, sort of prioritizing things, not having sort of endless things at the same time, but filtering appropriately and doing it in a way that's private for people to do in advance of the visit when they have a little more time, a couple of days in advance, or as an outreach campaign, I think we get, great adoption. We really aim to have 80% or more of people doing all of this before the visit.
I know one of the things you and I were chatting a little bit about before the episode was something that you were pretty excited about, which was medication adherence, and I know you kind of talked about it a little bit early on. Can you talk a little bit about, you know, how Phreesia is like improving medication adherence?
Yeah, this is something I'm super excited about. So we've sort of stayed on the sidelines with this for a long time because we've seen a lot of companies try and tackle medication adherence and have a really rough time, just for the same reasons you said. It's like really hard to get people to fill out surveys and be engaged. So we really wanted, if we were going to do something in medication adherence, it had to be really smart and thoughtful and something that sort of we uniquely could contribute to. And so ultimately, what we realized is that you know, 1 in 3 patients, and these are sort of NIH numbers, will never fill a prescription that they're given. So a lot of thought and attention goes into what prescription to give them. It goes to the pharmacy, the patient never picks it up, and that's a huge problem. There are costs associated with that, but the biggest cost is that people end up further behind in treating whatever condition it was. And that's kind of the best case scenario, that they show up 3 months later and they're like, I didn't take it. The worst case scenario is that it's someone with hypertension who doesn't feel the symptoms and then suddenly has a stroke and ends up in the hospital. And so, what did we think we could do? Well, what we realized is that a lot of times clinicians would say, I just wish I could sort of pick up the phone a few days later and say, did you go? Did you pick it up? Did you take it? But that's just totally unrealistic. And so we basically created a product that does that. It's just saying, you just got a prescription written. Do you intend to pick it up and fill it? And if the patient says yes, no. If they say yes, it's like, yay, okay, great, you're good. If they say no, we ask more questions. We ask them why they're not going to fill it. And then we try and address some of those things. You wouldn't be surprised by some of the reasons: costs, transportation. A big one is, I don't have any symptoms and I don't really think I need this. And so we can address those things. We can send people to patient copay assistance programs, patient support programs, and we really think we can make a difference with this. And we're really working to scale this very broadly right now.
I'm excited for you. Thank you for all that you're doing. What is there anything else that's next that obviously this is big for you. Anything else that's next? I guess call it what you can share. I know there's probably some stuff that you can't share, but over like the next 6 months or so.
Well, I think we're pretty excited to see these different streams sort of just come together and really have more understanding of how healthcare businesses really need activated patients, and how we can make it really possible for people to achieve that with their patient population. Get better. That's what we're excited about.
Well, I'm excited to continue to stay in touch and to follow along with everything that you're doing. Thank you for everything that you're doing, and wishing you and the team the best of luck. And we'll be watching out.
Oh, thank you. And thanks for giving us the opportunity to talk about it today. I'm very excited to be here.